Okay, so today we are working with Molly. She just had an ACL reconstructive surgery, has some quad weakness, so we're going to be hooking her up to E-stim to try and stimulate that quad. The indications that she would be a good candidate for NMES is that we are really focusing on the neuromuscular re-education, and we want to get the quad strength back. Some contraindications where we would not want to use the E-stim on this patient would be someone who is pregnant. We wouldn't want to use E-stim on the abdomen, back, or the hips. Don't want to use it on the eyes, any kind of open wound. And yeah, those are just a handful of the contraindications. Oh, any loss of sensation on the skin. So, Molly, today we are going to be hooking you up to an E-stim machine. What it's going to do is it's going to send some electrical impulses to your quad to try and get that quad firing and contracting again. So first of all, is it okay if I touch your thigh, just this region? Mm-hmm. Okay. And any loss of sensation on your thigh, like where you don't feel anything? Okay. Mm-hmm. Any, like, I don't see any open wounds or sores or anything. Any pregnancy, pacemaker? No. Okay, good. So I'm just gonna have you seated. Are you comfortable? Mm-hmm. Okay. Yeah. So I'm gonna place these thigh right there. Okay, and so when we get started, at first, I'll turn up the intensity slowly. At first, you'll just feel I like a tingling sensation, and then as we turn up the intensity, you'll actually feel like your muscles start to twitch, and then you'll have a muscle contraction where your leg is actually going to straighten all the way out. And no shot time should you feel any pain. So if it starts to become painful, let me know and we can stop. And when your leg does straighten and your quad is contracting, I want you to really think about contracting your muscle and try to get your brain firing to try and contract that muscle as we're putting electrical stim through it, okay? Okay. Good. So we're gonna come over to the settings. First of all, we wanna do biphasic, so push that, have the green light turn on. The patient is hooked up to channel 1. 10 minutes is a good treatment time. We're gonna go down to rate, and we wanna turn the rate up to between 80 to 100. So we want the patient getting a sustained muscle contraction. We don't want her to be feeling every individual pulse. We just want her to feel one pulse and get one long contraction. So we're gonna leave it at 80. We can go down to width, and we want the width at 200 because we want to be activating those motor neurons. So in order to get a muscle contraction and activate those motor neurons, it needs to be at 200. And then we can come over here. We're gonna put the duty cycle on 10 over 30. So she'll be on for 10 seconds and then she'll have a break for 30 seconds. And then ramp, I'm gonna change it to 1.5, so that gives her a little more time for the intensity to ramp up so it's not all coming on at once and surprising her. Okay, so Molly, I'm gonna start turning up the intensity. Like I said, at first you should just feel a little tingling, a buzz, and then you'll start to feel a contraction, okay?
Okay.
So let me know when you start to feel something.
I feel kind of a buzz now.
Okay.
Mm-hmm.
You doing okay?
Yeah, I'm good.
How's it feeling?
It's good.
Starting to get a muscle twitch?
Yeah.
Okay.
I can definitely tell it's trying to fire.
Okay. Yeah, start to see it there. You doing okay?
Mm-hmm.
Okay.
Yeah, just kind of a little uncomfy.
Uncomfy, that's a good word for it. Okay. Let me know when it feels okay.
That's good.
That's good? Okay, and then we'll start you there.
Oh.
Yeah.
That's like, is it going to be on the whole time?
So as your muscle is contracting, really think about contracting with this E-stim, okay?
Okay.
There you go. And now you'll get a 30-second break to relax.
Okay.
And really think about contracting your quads. Good job. And we're just going to do one more and then we'll be done, okay?
Okay.
Any pain with this?
No, it's just kind of uncomfortable.
Yeah.
That's okay.
And contract. Think about firing your quads. Good, and we'll stop the treatment now. And then, can I take these pads off of you? Okay. So, as I'm removing the pads, I'm just going to be inspecting the skin to make sure that there's no redness or irritation or anything that would show signs that her tissue didn't react well to that treatment.